Well, welcome all to tonight's amazing event. We're still people are still straggling in. We're admitting them one at a time. Why don't you take some time out and introduce yourself to everyone in the chat? Let us know kind of where you are. Let us know where you're from and kind of what your interest is and what you're hoping to learn. Um, I think of myself as a holistic speaker, which means that I really modify what I'm going to say in order to best address the needs of my audience. So I think it's a pretty good thing that I've learned to do over the years because you don't want to be talking about stuff that nobody's following you. What's the point? The point in talking? So yeah, so let us know where you're from in the chat. Let's get going there, and then we'll give it just another minute or two. We tonight, I'm not. I decided that people join this meeting because they want to get their questions answered. Maybe the questions have to do with our topic, maybe they don't. And you're spending time out of your life to come here and listen to us. So I think it's my responsibility to answer your questions. So we've decided that in a new way of doing things that we're going to stay until all the questions are answered, which could be a dangerous thing to say, but we're going to give it a try. And so that's why it's not quite as critical that we start right away so we can finish, exactly on time. What do you think that little red dot means under participants, Haley? That means that you press the record button, or you're responsible for under
Yep,
participant.
yep. And then it's looking like the green sharing is yours.
Yeah. Oh, okay. Oh, that's cool how it does it. Yeah.
Hmm. Yeah.
Okay. And there's Lauren and Misha, Bruce Wayne. Yep, we know Bruce Wayne. Yeah. I first does he look like Batman? So
I love the name. It's so cute.
very cute name. I think pet names are super cute anyway.
Yeah, and Misha, you make great videos on Instagram. You know what you do there is awesome. So just wanted to say that. We love watching a Bruce Wayne doing his thing.
Okay. Okay. So, well, 24, that's not too shabby as far as a number to start. And it's, 2 more minutes. We'll bring it up to the 5 minutes after the hour. And then we'll get started with our housekeeping.
Yeah, I can read that for you. So, today's agenda for Doc Rob Live, and we do some housekeeping information. So, I do have some questions from email that we will use for our initial questions there. You could also put your questions directly into the chat, and we will make sure that we get to them. We plan on not finishing this event until all the questions have been asked. And raise your hand if you aren't understanding, what is being said. Definitely, want you to be able to ask your questions and, want everyone to learn and benefit from this time together. Our disclaimer, want to be able to help everyone, limited in my ability to give the perfect answer to your question by the lack of a doctor-patient relationship. I'm not examining your pet. I don't have the diagnostic information to help me, so please understand the limitations inherent in this platform. I will do my best, so we may need to follow up later with an email conversation.
And so the disclaimer there, even though you did it in the first person, Haley, really is my disclaimer.
Yes.
And I do want to be able to help everybody, but there are limitations with how much help I can give, not having a doctor-patient relationship, and that's a whole nother story we can talk about someday. So, we've got people from Tennessee and from Vermont, even someone locally here from Longmont, a neighbor of mine, I guess, Alabama. Loranda's cooking hamburgers tonight. We get a little slice of everybody's lives here, don't we? Bruce Wayne, she calls him Bruce Wayne because his ears are so big he looks like a bat. So, this is fun. This is lots of fun. So okay, so that's so and we'll just keep admitting people as they come. So okay, so that's our basic housekeeping information. We are not planning on finishing these event until we get your questions answered. We do have some questions that have been submitted by email, and then we're also planning on taking whatever questions you guys want to submit tonight. We're doing these about the fourth Thursday of each month, but that also depends on when I'm doing my pet Q&A mushrooms, which I do the week before, and there are sometimes circumstances scheduling things like that. For instance, this month we're the first week in August, not the fourth Thursday in July, simply because we have to shift some other scheduling around as well. But we'll do our best to keep it as regular as we can. And they will be recorded live. So we've gotten some outreach from people who wanted to know that if they missed it tonight, because the timing isn't always great for everybody, would be able to see those live recordings. And yes, they will be on our WellPet website and our YouTube channel. It might take a day or two to get there. Also, because as we've been doing these, um, the as we've been doing these, we've noticed that people just stay on for the whole time. And so, I think that's great. That's why we're going to answer all the questions. But also, for those of you who want to stay on after the questions have been answered, I think what I want to start doing is actually talking about the products that I sell on the website. So, obviously, there's going to be some some salesy stuff there. But what I really want to do is the products that I have on my website are very very powerful. They're professional level, and they might be a little bit complicated to understand how to use them or when to use them. And so I think that by talking about each of them, we can learn more about you can learn more about these products. You can decide if it's something you might want to add to your pet's protocol. And and I can help you with dosing and things like that and how we administer them. And we're going to try to detail those products that are also relating to the topics that we're talking about tonight in general as best we can. So we may go back and repeat the same products because oftentimes the same products might be good for other conditions as well. For those of you that know I've written a book, there's a mushroom for that. Haley and I are wearing our t-shirts tonight with the cover on it. That's pretty cool. Um, yeah. And if you purchase this book on Amazon and can send me a copy of your receipt, we're happy to send you a discount coupon of 25% for 2 times for anything on the website. So let us know that. And I'm also thinking about offering another monthly topic live, more didactic, more educational. And if that's something that's of interest to you, please reach out to us. And you can reach me at questions@wellpethelp.com. That's really the best email to reach me at. And make it bold, let you know it's best. And so let us know if there are things that you would like to learn about. So this month's topic, which is not that dissimilar from anxiety because it still deals with behavior, but we're looking more at the mentation part of behavior. And I went to look for the definition of what is cognition or cognitive behavior defined. I went to the internet, found an AI definition, which it refers to the mental processes involved in acquiring, processing, and using knowledge. It encompasses a wide range of activities, including thinking, perceiving, learning, remembering, problem solving, and decision making. Now, these are all, relative to human cognition, but I think we can all see how it can also relate to our pets' cognition. Yes, they do think and they do try to do problem solving and they do learn and they perceive and they have sensory perceptions and they do have memory. So it's all really, and they do make decisions. So it's really it's really very similar. And we've come a long way from the day from the time when we used to think that our pets were dumb friends. There's a place in Denver called the Dumb Friends League, which I've always thought was they should change that name. But they're not dumb at all. And they understand us and they have a great deal of intelligence. It's not human intelligence, it's animal intelligence. And circumstances and environment and acquired things like eating certain types of foods and stuff can affect our ability to think, to make, and if it affects our ability to think, it can affect our ability to make decisions. And so when our pets behaviors um, are really they behave in a certain way because they have certain things that they want that they are trying to solve. And they have problems they want to solve. Where are they going to, how are they going to get fed? Where is the food bowl? Are they going to be able to go out and have a walk and go sniff around or take care of their urination or defecation? And so, their cognition is responsible for driving that behavior, how they perceive the world. And and in some cases, we have problems with that cognition or with that, and that can drive that behavior as well. So I recycled some of the slides from our anxiety talk because I think they can also pertain to this as well. I think, and I know for myself that I also find that when I am anxious, that it also affects my ability to think, my decision-making ability, and my mind sometimes gets all jammed up with my anxiety and doesn't allow me to calmly look at the events that I'm looking at in order to make the appropriate decision. So, we talked about, different signs that they look at, with cat behavior, how body language is really important in terms of understanding your pet. And I think it's really important that we do try our best to understand what our pet is telling us through their behavior and how we can then help them if the behavior is not being very effective or functional for them, how we can help to change that behavior. And so, a lot of these behaviors we see as far, like when we're talking about cats, they might follow you around, they might be aggressive. They may overgroom. There's all sorts of different behaviors that they can do that would be signs of anxiety for them. Likewise with dogs, they might be panting a lot. They might be drooling. They might have destructive behavior. They may have accidents in the house, those sorts of things as well. Um, so, when it comes to behavior, I'm a veterinarian, so I always, behind every bush, I see a medical problem or a medical answer, and so you want to rule out that there possibly could be some medical causes that are affecting cognition, which could be affecting behavior. And there's certain diseases. Epilepsy has been associated with behavior changes, and by the way, next month we're going to be talking about epilepsy, but because this talk is a little early in the month, it's really going to be it's going to be the third week of this month as before, so it'll be coming up pretty soon. I think epilepsy is a really good subject to talk about. I feel pretty comfortable about my skills in that area, and I'm sure that there's many of you out there who have pets who are suffering from this tragic disease, and it can sometimes be very well managed, but sometimes not so well managed. Also, metabolic changes, diabetes, Cushing's disease, obesity, these can also affect behavior and cognition. Cancer, certainly cancer of the brain or inflammation in general, or adrenal tumors, where adrenals are secreting corticosteroids or secreting, adrenaline and the fight or flight or hormones. These could all be aspects that could affect behavior and cognition. Um, and we talked a little bit before about how to figure out what things might be cueing your pets into these behaviors and how we can desensitize or counter condition them to help extinguish these behaviors. And I think the primary concept there is that we want to reward good behavior, but punishing bad behavior really doesn't do a lot of good. And it creates this almost a violent antagonistic kind of a relationship between you and your pet, which I think in the long run is not good, even if your pet will listen to you when you get really angry with them and hopefully not strike them or whatever when you yell at them. Um, and then there's a variety of different medications and supplements and diet and acupuncture, and I want to talk about those with regard to cognition. We talked about different interventions like feline pheromones, so the cat feels comfortable where they are living. Certainly the cannabinoids, we'll get into that some more at the end because I'm definitely going to be talking about my cannabis products. And mushrooms, we'll be getting more into mushrooms as well. And I'll be talking about the mushrooms also at the end as far as those products. And then there's different supplements that can kind of settle the mind down and maybe help the mind to focus better. Herbs that are calming. There's a milk protein called alpha-quizazepine, which has a nice calming effect. None of these are sedating. All of them really, I think, help to reduce the chatter, and improve the clarity of thought. Even probiotics. I've seen that Purina, as you can see with this picture down here, has has probiotics that they've proven, benefit the microbiome in such a way as to produce a calming effect. And then there's the pulsed electromagnetic force devices. And I know this cold and looks like a little angel there, but that's actually a loop that is transmitting these electromagnetic waves that are going into the brain that are helping to calm it down a bit. Now, these tools all need to be used as part of a behavioral modification kind of a program that you're doing, behavioral training. So that's kind of the slides from before. And so then, talking about cognition in general, these are the things that I think are really important, and they're really lifestyle changes because cognition is something you have your whole life, and every little thing in your life can affect your thoughts and your animal's thoughts as well. So, the first thing is eliminating ultra processed foods. And these are the foods that are extruded, are treated at are cooked at high temperatures and high pressures, which alter the molecular structure of the food. The raw materials that go into these foods generally are already processed, already ultra processed, and oftentimes are the byproducts of the food processing industry. Um, let me get rid of this thing here. Hide hide floating meeting controls, right? And put this up here. Okay. All right, there we go. So, so that's where I believe strongly in the value of home prepared foods, which can be quite a chore to do and quite a task and not necessarily cheaper or easier, but definitely better if you can do it right. I've heard it said that the best food in the world is a home prepared diet, and the worst food in the world is a home prepared diet that's not balanced or complete for that pet. But there's a lot of guidance these days. There's a program down in San Diego called the Feed Real Institute that can teach pet parents and teach veterinarians how to formulate diets for themselves. There's a lot of online stuff, and there's a number of companies now which are offering really good quality foods that you don't have to prepare. You have to pay the price, but that makes it much easier to provide your pet with the good quality food. And we see this in children as well that eat a bunch of junk food and they become hyperactive and they just can't settle down. It's the same. It's really the same deal. So look to your diet. Now, we can't all afford, have the time or have the budget to do the very gold standard of home prepared pet foods or minimally processed pet foods. But my recommendation is do the very best that you can within your life, within your lifestyle, within your budget, and that's the best job you can do, and that's great. That's what I suggest because some people feel guilty, about not being as good with how they feed their dog as somebody else. And really, I think it's the love and the intention that comes from your heart that feeds your dog and your cat and your other animals, your horse, best. So just look to what you're feeding and try to avoid the ultra processed foods as much as you can. And by feeding a better diet, we're also going to be supporting a healthy microbiome. And what's amazing is that the microbiome really does influence behavior and cognition. There's this, maybe you've heard about the brain gut axis. Well, it's a real thing, and the brain is connected to the gut by the vagus nerve, and there is apparently it's like a superhighway back and forth with all these secondary metabolites and nerve signals going back from the brain to the gut and back and forth. It's the basis of that brain gut axis is also the basis of like irritable bowel syndrome, which is, very much connected to stress and emotions, So the healthy microbiome, better foods, that's the first place to begin. Mushrooms are great for the microbiome. The fiber is terrific as far as feeding the bugs in the microbiome, and the beta glucans and immune modulation of the mushrooms really helps to improve the microbiome's balance, in terms of the good bugs versus the bad bugs. Um, and the mushrooms also provide immunoregulation in general. Fermented foods, I mean, there's a lot of value in probiotics, but I think the big trend these days is to not go with the laboratory created probiotics, but to go more with fermented foods. And there's several companies out there that are doing really good jobs with fermented foods. One's called Green Juju, one's called Solutions. There's Gussie's Gut. There's a number of these offerings out there in the marketplace for you to add to your pet's diet. We're looking at adding those on to this website. I want to add several different diets, several different supplements with fermented foods like that. I want to add to what we have. I'm going to start by feeding Ollie and find out what I like to feed him the best, and then suggest that. Um, and a lot of them, what we're going to do, because it's many of these foods are frozen. We have a diet right now a that's based on food on traditional Chinese medicine food therapy. It's called a Qi diet, Qi dog rather. It's called Qi dog, and it has different diets based on what the temperature is. What the energetics are of your dog, or what the condition is that you're treating the dog for, and using the food therapy to also address that condition. So we'll probably do a lot of affiliates, so that way because we can't really ship out frozen stuff, and when you're taking on new products for a website, it's a lot more reasonable and better to start using the affiliate approach. So just look to that can be happening. And certainly fish oils, if there's only one supplement you're ever going to give, other than a mushroom, which you could have as part of your diet, I would say fish oils are really the most important. And second would be the antioxidants, and you can get antioxidants in your food if you're feeding green leafy vegetables and brightly colored fruits and vegetables, which are very rich in naturally occurring antioxidants. Um, okay, so that's kind of building the foundation there in terms of the health, the physical health of your of your pet, and its physical and the physical health of its cognitive um, skills. So then we want to look at what issues your pet's behaviors are signaling and how we can reduce those cues. This is just as we were talking about with anxiety, and a lot of that involves, observations. Sometimes, we're too close to our own critter, and we need to talk to someone who has more objectivity and maybe has some experience looking at pet behaviors to give us a better idea of what we need to look at in terms of how to reduce the behavior if it's not a healthy behavior, it's not an effective behavior. And so there are behaviorists that can help you with trainers, and there's also animal communicators. And I don't know, how much you guys have ever had an experience with animal communicators. I know it's a little woo-woo, but I'm a little woo-woo, actually. And I've worked with this one animal communicator for the last 30 years. And many people that I speak to know her. She's apparently quite popular. Her name is Terry O'Hara. She's up in Eugene, Oregon. And one of the things I want to do with this time that we spend together is I'd also like to start having some guests on that we can talk to. and we can ask questions about. And one person I'd like to have on would be a canine massage therapist because I think they really are unsung heroes when it comes to helping pets move better and feel better. I'd like to get some animal communicators on as well. I think that'd be great. We'll get Terry on, maybe get several animal communicators at the same time and have them talk about how they do what they do. I think that'd be really pretty cool. Um, and then, behavioral training is really important. Your dog needs to know, dog just wants to please you, and then it needs to know how it can do that. And so you need to use positive reinforcement to let it know which behaviors are the behaviors that you want to have it have, and and don't encourage the bad behaviors. There's no bad behavior, but the behavior that is unwanted. And you may have to, work with a behaviorist. But these days, with online, you can actually have access to behaviorists all over the country, really good behaviorists that can work with you that way. So that's something to think about as well. And certainly, many people are adopting rescue pets. So you don't get, so sometimes they come bundled already, like my Ollie did, with fears, PTSD, or with behaviors that aren't very, healthy. And so that makes it a lot harder, versus starting with the puppy when they're a blank slate, which would be my preference. But as a vet, I always get rescue dogs. So think about that as well. But whatever, whether it's an older dog, yes, you can teach an old dog new tricks. It just takes more time, or if it's a young dog, that makes it much easier. Behavioral training is really important. Your dog needs to know, what you want them to do. Your dog needs to know that when it runs out into the street, you can call it and tell it to come back, and it will stop and do that and not get hit by a car. So, I mean, behavioral training is not just a cool thing to do. It actually provides some safety in terms of your relationship with your pet. And then environmental enrichment is a really big deal these days. And when you think about it, especially now that many people are going back to work from COVID shut-in, we're kind of a number of years from that. But the dogs get to stay at home alone. They're bored. The cats are bored. And play behavior is a really important thing for animals, and it does more than just it's just more than just fun. It actually feeds their mind, it feeds their body. It's really a wonderful thing. And so they do things such as how you feed your animal. Like some people will actually hide little bits of food around the house so the dog makes it into a game. They've got these new flat plates that you can put the food in with all these ridges, so the dog has to really work to get to its meal. Dogs like that. Dogs like working for their food. We've got these catios for cats. You can even just putting a harness on your cat and taking him for a walk. That's environmental enrichment. They're making all these really cool treats. I got a real dog box from the Real Food Institute. I did a podcast with them earlier this week. I'm going to be at their conference in San Diego in October. If anybody's going there, I'd like to say hi to me there. So they provide all these different treats like these dried duck wings and different types of treats that also are ways to provide environmental enrichment as well. So then that's kind of lifestyle things, and then supplements, which we'll get into if we have specific questions, but certainly calming herbs, CBD and CBG, foods can be calming, mushrooms can be calming, can support healthy behavior. All of those nutraceuticals like tryptophan, theanine, alpha-quizazepine, the milk protein, melatonin, and we're hearing a lot about magnesium these days, online. Calcium magnesium is an old time remedy for calming. Both calcium and magnesium are calming. That's one reason people say drinking milk, although there's other issues with drinking milk, but drinking milk can be calming because of the calcium and because of the quizazepine that it contains in it. There are Chinese herbal formulas that can help to address your pet's constitutional behavior. There's insomnia formulas. There's a number of different Chinese herbal formulas that if you connect with a Chinese practitioner who can look at your dog's tongue and feel its pulses and take a thorough history, they can figure out which Chinese herbal formula might be best to settle your dog's behavior and make it more effective and healthier. And then, as a veterinarian, I'm not against the use of pharmaceuticals. I think they have a time and a place when they're appropriate. And there are some pets who do have some very serious behavior problems that could be life-threatening to them, could be life-threatening to people around them or animals around them. And in those cases, I think the judicious use of psychiatric drugs, maybe not forever, but maybe just enough to help get things in better shape so things are safer. So I'm not against that. It just need to be used properly. It need to be dosed properly. And you can use psychiatric drugs together with herbs and CBD and mushrooms. I've been doing it for years in my patients, and I never see any issues, any side effects or problems with that. So the last two slides, we're going to talk about products, but that basically stops where we're at here. And so let me stop the share for a little bit and see if there's anything in the chat that's of interest. Okay, cool. So yeah, Terry's website is Animal Wise. That's ANIMALWI. I think it's WIZE.com. Try both. But yeah, she's awesome. She's amazing. She's read Ollie a few times. I don't know if you know that I'm doing a canine microdose project where we're looking at the effect of microdoses of psilocybin on some of these adverse behaviors that we see in dogs. And so there's only so much you can figure out from microdosing because it's really subjective. So I've actually had Terry read Ollie after his microdosing experience so she could communicate with him and have him share with her how it made him feel. And as a result, I've lowered the dosage multiple times for him because he's very, very sensitive. So, okay, well, I am ready to start answering questions. We did like a 30-minute intro there. And and then so we'll let Haley take over as the moderator in general, and she'll be directing the questions to me, and I'll be answering them.
Sure. So starting off with one from the chat that I have here. What can I give my 17-year-old cat to help her breathing? Lots of thick mucus covers nostril that I constantly have to get off her. She sneezes a lot, often uncontrollably too.
Well, the first thing I would say is, have you checked your cat for a viral infection, a viral upper respiratory infection, which are quite common in cats? Herpes virus as an upper respiratory infection is quite common in cats. And that could be why you're getting the stuffy nose and the crusty eyes and those sorts of things. And I think that would be a good thing to do. You'll see your veterinarian, and they can probably run a test to check that for you. That being said, there are several herbs and mushrooms that can be helpful for upper respiratory difficulty in breathing and upper respiratory phlegm. And as a mushroom, the first thing I would recommend would be cordyceps, which has a very strong presence in the lungs and the respiratory tract. If it turns out that this is actually a herpes virus infection, then the cordyceps could also help to improve the immune system response to that. Another mushroom called reishi is also known to be good for herpes virus infections. And there is a product that I don't think I sell it on the website anymore because it didn't sell well enough, but it's a product I designed for RX vitamins, and it's called a feline. Been too many years. It's feline immunosupport, I believe, and um, it contains lysine, the amino acid lysine, which is really good to use when you do have an upper respiratory viral infection in your cat that is a herpes virus infection, which is one of the most common upper respiratory infections. So I definitely would check that out because that would be, I wouldn't say it's an easy fix, but definitely it'd be hard to use symptomatic herbs and mushrooms without first knowing if you're dealing with an infection. Um, there are some Chinese herbs that can help with upper respiratory phlegm. I don't carry any in my shop, but if you reach out to me through my questions um, at get wellpethelp.com, that I can maybe link you to a product that I can find for you on Amazon. Okay, next.
All right. We have an 18-year-old Tibetan Terrier who is having CCD problems. What is the best approach to help him? Mushrooms, CBD?
Well, and when we made tonight's topic, we really had CCD in mind, and those are the initial CCD stands for canine cognitive disorder. And it's really and as we're learning more about it, it really is kind of a doggy Alzheimer's kind of condition. And it comes on slowly and it just kind of builds up over time. And maybe the first signs you miss because you just think the dog's being stupid or something. But ultimately they wind up having trouble finding their dog door, finding their food bowl. They just kind of stand there staring, or they start barking at something or nothing. Ollie is actually starting to do that as well. So there are mushrooms which can work for that, particularly the lion's mane mushroom, which has been very helpful for humans who have a sundowners type of syndrome, just like that, where they have this cognitive disorder as they get older. We call it dementia, which maybe is a little kind of strong and unfortunate that there's so much of it going on. But lion's mane would be the first place that I would begin with a dog that has that problem. Now, lion's mane contains two things in it. The lion's mane mushroom contains two things in it that are very good for cognitive function. And one is a terpene that's in the mushroom called hericenones. And these hericenones have been found to stimulate brain-derived nerve growth factor, which also helps to make the mind work better in terms of memory. It works with synaptic plasticity as well. But the other part of lion's mane is an antioxidant that we're really excited about called ergothioneine that comes from the golden oyster mushroom, a beautiful specimen. I grew this myself. Um, and ergothioneine equally has been found to be effective for many of these senior dementia types of syndromes that we're seeing, including human Alzheimer's. And lion's mane is in some studies for human Alzheimer's, as well as ergothioneine. And the studies support that if you're using it in early Alzheimer's, you can get that many times you will get some kind of response. Does it cure it? No. It may slow it down, and it may give a brief respite. And we're just now kind of getting into that. And so we're not quite sure, how long it would last. So, but that's what I would suggest. We have lion's mane comes in a pouch now. Um, we did have capsules. No, we do have capsules. You've got capsules and a pouch. Sorry. We have capsules in a pouch. The lion's mane itself is very tasty. Some people say that it tastes to them a little bit like lobster. I like the fresh lion's mane mushroom to cook. It's really tasty. Um, you can kind of make thick steaks out of it even. So, so yeah, we have that in capsule form. We're just getting started. I've got to find some time to finish my product page for ergothioneine. We'll sell the ergothioneine just as an individual capsule, which, we may wind up selling more of it for the pet parents than for the pets themselves, just because it works so well. I'm an older guy. I'm 76 now, and I have been experiencing some memory issues that are just normal for age. Thank goodness it's normal memory issues. Um, and kind of embarrassing because I'm supposed to be a smart guy and get paid to be smart. So I've been taking the ergo myself, been taking it in high dosages at first for like a month or two, and then a lower dose. And I'm not just trying to sell the stuff. I really feel like it has helped my cognitive ability, my memory. I don't go into the other room and forget what I was going in there for as much. I still do it some, you know. So it's worthwhile thinking about. Okay, so that's what I would suggest for your 18-year-old. Let's look at the next question.
Yeah, so we have a question about lion's mane. Is there a better time of the day to give lion's mane?
No, because the lion's mane is not a drug. It's a superfood. It's a mushroom, which is a food. And so it really has the best effect when it's given every day. It doesn't matter what time of day because the effect is a more of a longer term effect. You may get some shorter term immediate effect, but it's not going to be as substantial um, as taking it every day. Mushrooms are meant to be taken on a daily basis. You shouldn't think of them like they're a drug. Oh, I'm going to take this mushroom and get over this problem. I mean, you may take the mushroom and get over the problem, but it's because you've taken it on a regular daily basis. So I wouldn't worry about time of day at all. I would say the time of day that works best for you is the best time to give the lion's mane.
All right, next question here. Why is my pet pacing or whining at night? It is something new that just started happening.
Well, certainly we can't rule out the possibility that it could be this canine cognitive disorder. There could be other things going on at night that are disturbing your dog, maybe things that you can't hear or smell, but your dog can. Maybe there's a new neighbor, maybe there's some animal in the neighborhood that's wandering around outside the window that your dog can smell and know it's there, but you don't. But it wouldn't hurt for you to give it a try with the lion's mane. Um, and I would try it, I wouldn't just try it for a couple of days or a week. I would try it for a month, give it time to get in there and start to change things around. And we've gotten very good reports. There's no study yet with lion's mane that has been published, but and I'm looking to see if I can't get something like that going, with our stuff. But right now, it's just basically anecdotally that's what we're hearing from veterinarians that are prescribing the lion's mane for that condition, and from pet parents who are using it on their own based on what they're reading. So,
All right, next question here. How can I tell if a behavioral change is due to pain or illness? What are maybe some signs?
good question. Good question. I guess in terms of pain, that might not necessarily the easiest, but the first thing that I would look at, because illness may involve first diagnosing what it is. But first of all, is there a reason to believe that your dog might have pain? Is it an elderly dog? Is it larger? Has it been active? Does it have some limpiness? Those kinds of things. And then maybe treating it, for the pain, and maybe treating it conventionally for the pain if its organ systems are able to handle these NSAIDs. Ollie, um, speaking from my own experience, um, Ollie came bundled with a really bad hips. He had a dislocated hip and a broken leg when I adopted him at 4 months of age, and he was treated by removing the head of the femur on the dislocated hip side, but his other hip, which wasn't dislocated, was bad. He's a lab, and they oftentimes don't have good hips. So he's been doing fine as long as he's been young and as long as he's been relatively light. But after Violet died, our other dog, he wasn't as active, and I started feeling sorry for him, and I started feeding him more, and he gained some weight and looking really depressed, and panting a lot and not getting up very well. And so I treated him. I got weight off of him, but then I treated him with Rimadyl, and because I thought it was safe to use for him. And he's been really, really happy lately. And I'm thinking that it's the Rimadyl that made him that dealt with the pain that altered his behavior. And so now what I'm doing is I'm weaning him off the Rimadyl to see if he's going to have that same kind of depressive look that he had before. I'm only giving him once a day instead of twice a day, and I do think I'm starting to see some evidence there. So yeah, so what I would do is I would try to, I would address the pain in an effective way. If NSAIDs aren't, in your spectrum, maybe looking at acupuncture, maybe looking at some of these herbs that have strong anti-inflammatory activity, looking at CBD could be a good choice there, because CBD has shown itself to be pretty good for most dogs to help with mobility, but not all dogs, and sometimes you have to go with a pretty high dose with that. You could look at acupuncture. There's a lot of different things you could do as far as the pain and mobility issue. As far as another illness, that would, I would say, talk to your vet, and have him do a blood test to check organ function, liver, kidney, white counts, things like that. That's the easiest way to screen for that behavior. Or you can just, or you could treat with the lion's mane and see if the lion's mane allows them to overcome that behavior, in which case then we can rule out that it was pain or it was an illness. It's complicated figuring things out in veterinary medicine, but I hope that helps you.
So, next question here. How do I know if my pet needs behavioral medication? Are those available?
Well, behavioral medication is that's what I was referring to in that last slide, if you were present for that, as far as psychiatric drugs. And as I mentioned, I don't think they should be used casually, but I think they can be used effectively in the right time and place. And so I think the use of them is when we're worried about the animal's behavior maybe causing some problems, maybe it's not safe the way the animal behaves in certain ways or certain interactions. And that would be a reason to want to use a strong drug like that as compared to using something like CBD, which many times I have people coming to me with their pets on Prozac and on Clomicalm and on Trazodone, or gabapentin, and want to know, is it okay to use the CBD? And I go, yeah, it is. And many times they use the CBD with it because I don't want them to stop the drug. I never tell people to stop what they're doing if I didn't tell them to use it because I don't want to step on the vet's toes and I don't really know all the facts about it. Um, so um, so that would be where we might want to use a psychiatric drug. But I would say, first let's try CBD, or my silver bullet, CBD, CBG. I've got a mushroom product, mushroom relaxed chews, which contain tryptophan and theanine. So they're going to produce some calming and some behavioral modification immediately, along with calming herbs. Plus, it has lion's mane in it. And it has reishi, which is also a mushroom that also has good benefit to the spirit, to the emotions, to the heart. Um, and you can use combinations of CBD with the mushroom relaxed chews, use them together. I have found that to be a very profound, doesn't sedate them, doesn't knock them out, but it really gives them a really good chill effect. So that would be my answer to the question.
All right, next one here. We've been using Silver Bullet at the recommendation of our vet to help our anxious pup. How long do you find it takes to reach full efficacy with daily use? Any other advice to get the most out of it for calming effects?
Thank you. Good question. So the studies show when we measure blood levels of CBD, that it takes about 10 days to 2 weeks for the blood levels to plateau. That means that they reach what we call a steady state. So you're not going to get the full effect of the cannabinoids, the CBD or whatever else is in there, I would say for at least 10 days, 2 weeks. That's why I tell people when I'm suggesting a dosing regimen that you start with a low dose and you give that low dose twice daily with food for about 7 to 10 days. And you look to see if the animal is responding in the way that you hoped they would when you bought the CBD. And if they're not responding in that way, then I suggest doubling the dosage because higher doses may be more effective. And when people tell me that the CBD didn't work, one of the first things I ask is, how much you given? What's your dog weigh? And what is the problem? Because those are all factors. The weight of the dog, how much we're going to be able to get into the bloodstream and into the tissues to have an effect, and then how serious is the condition? There are some conditions out there that are so bad that CBD is not going to touch it. Even drugs don't touch them. So so I would start at the low dose, and the low dose is about a quarter of a milligram per pound of body weight twice daily. Um, Depending on what CBD product you're using, that translates into a different volume of CBD tincture depending on how concentrated it is. Our silver bullet, which is very concentrated, it has like 60 milligrams of CBD per milliliter. You might just be giving, a quarter of an ml, which might be just 15 milligrams, or you can estimate less than a quarter to give less than that. Drops aren't as accurate, but they're the best we've got when you go to the lower dosages. The sterling silver, which is identical to the silver bullet but is less strong, contains about a quarter of the milligrams of the strength of the silver bullet, it has 16 milligrams of CBD per milliliter as compared to 60. So that's almost a four-time difference. Now, the silver bullet is actually more cost effective. It's only twice as expensive as the sterling silver, and you're getting, four times as much potency to it. But it is an investment, and you do want to know that the CBD is working for your pet before you invest in that. So we give it with food, and there's a lot of misconceptions about how you administer CBD, and there are studies and studies and studies. There's studies in humans, there's studies in rats, there's studies in dogs, there's studies in horses, all of them that show that when you give CBD with food, it's 5 to 10 times better absorbed. You get better blood levels that way. Even with horses, if you give them the oil in their mouth as compared to giving them some hemp pellets, some pellets of hemp that have CBD in them, they do so much better in terms of measuring the blood level. So I suggest, and the best food, especially for a dog or cat or human, is fatty food. And I think for dogs, the quintessential fatty food for a dog is canned cat food, and dogs would kill for canned cat food anyway. But then there's also, cream cheese and cream and butter and peanut butter and hamburger, that has higher fat in it. There's a lot of different ways of doing that. And you give that, you put the dosage in that food and you give that to them first, and then you feed them their meal. Makes it a lot easier than trying to chase them around and squirt it in their mouth and not get that little dropper dirty. Because if you get that dropper dirty and you put it back in the bottle, you're going to contaminate the bottle, and it's not going to have the same shelf life that it did. So that was a good question, and that would be my answer as far as the best way to use CBD. Dosage. Think about dosage. That's really important. And there is no one dosage. There's no one right dosage. The right dosage is what that animal needs. And the only way we can do that, you can't know beforehand. This is what I've learned, is you have to start low and you work your way up gradually over time to find out which is the best dosage for that animal, for that animal's condition. Next question.
So I do have another question here on dosing in the silver bullet in particular. So currently my Chihuahua, Bruce Wayne, is taking the organic silver bullet CBD for his focal seizures, combined with real mushrooms, lion's mane powder, MCT oil, M&M powder, and red light therapy. He hasn't seizured in 2 months. My question is, what's the difference in this silver bullet CBD oil than other CBD oils? Why do I only have to use 2 drops of this when other brands they suggest up to 0.5 mLs? I'm happy with yours and will continue to purchase it. I'm just wondering the difference. Is it just the potency level?
Yes, that's one reason. I blended there's actually two cannabinoids in there. There's some very small amounts of other ones, but mainly it's got CBD and then it has CBG. And CBG is also made in the cannabis plant, like CBD is. But it also has been shown to be stronger than the CBD in terms of relieving pain. And it's even stronger than THC in terms of relieving pain. It's as strong as CBDA, if you're familiar with that. That's the raw acidic form of CBD that's available in Elevate products. And so, because in this one study they compared CBG to CBDA, they were basically the same. And if you've ever tasted CBDA, it tastes awful. That's the big problem. Elevate's a great company. They spend a lot of money on research and their products are good, but the CBDA is really pretty bad tasting. It's hard to taste, and they've had to make a lot of changes with their products in order to make them more palatable. So that's why I chose CBG, because it's been shown, it's been measured to have similar, if not the same potencies, and it's tastier. And when it comes to calming, for instance, we know that CBD calms through two pathways in the body, and that CBG calms through two other pathways. So when you combine the CBD with the CBG, you get a much more profound effect on calming. Or it may be that in a certain individual, that their anxiety is due to one pathway, not to the other two or three pathways. And so this way we're covering four different pathways. And so it's more likely to have an effect on an individual's anxiety. But at the same time, the CBG is also a very good pain reliever. It's comparable to THC, if not better. So that's why I put it in there because it ups the ante. I dose things by the CBD content, and yes, it is more potent because most when I go to the store, I go to pet stores or things, and I look at their CBD products. They're so weak. They're so weak, and big dogs need big dosages. I'm always surprised to hear that a dog is getting 3 drops of something that's weak, and the owner thinks they're improving. And I wonder if some of that might be a little bit of wishful thinking on the part of the pet parent, because that does happen. Even in spite of how bright we are, how objective we are, how good we are at making observations. I think when it comes to our beloved pet or a family member, I think that we are also subject to internal bias with our observations. Anyway, I'm real talky tonight. I hope this is good. What's next?
So this is a question that, can back off of that there. Do you feel like the variation in dosage that a pet may need of CBD might be because individual animals have different numbers of receptor sites, or that more of the sites are already occupied, bound by other substances, thus decreasing the efficacy of the CBD?
Yes. I think those are all good ideas as far as why it may not work. It also may be that for that individual, CBD is not the right treatment. It's not a panacea. It doesn't cure everything, which is kind of what we hear through a lot of internet communication. That it's try CBD for this, try CBD for that, try CBD for cancer. I think it could have a benefit and to some degree with many of these conditions that we're looking for it to do, but it's not guaranteed. It's very individual. And yes, it does have to do, I would say, when we talk about the receptors, what we're really talking about is what's called the endocannabinoid system. And the endocannabinoid system is that system of receptors and molecules in the body that existed before we knew that cannabis interacted with it because it is a very important system in our body that helps to maintain homeostasis. It helps to regulate pain, helps to regulate metabolism. And just by accident, the CBD molecule and the THC molecule, the CBG molecule, they all mate with these membrane receptors that are part of our own inborn endocannabinoid system. So that's why CBD and other cannabinoids can have such a wide range of benefits, different benefits as well, because they're working with the endocannabinoid system. But that's also why individual response can vary because each individual has a different endocannabinoid system, a different number of receptors and different numbers of little molecules and everything else. So it is very individual. And that's why I recommend a very individual dosing scheme, which to start with a given low dose with your animal and then observe over time to see which works the best for it. It can be a little pricey to begin with in terms of the amount of CBD you need to use to determine that, but otherwise you're wasting your money if it's not doing what you want it to do. Okay, next.
All right. How can I help my cat adjust to a new living situation and two other cats?
Well, that could be a real problem. It depends on the cats. Some cats, they just blend in nicely. Other cats, forget it, they never will. My daughter, Callie, adopted a Maine Coon cat. We have Maine Coons in our household. And most Maine Coons are pretty agreeable. They're pretty friendly. This one isn't. She's kind of a little kind of cat. And so sometimes when Callie comes home, she brings her cat with her. And there's no way that our other two Maine Coons are going to have anything to do with that one, ever. Ever. We've tried, believe me. But in terms of answering your question, what's suggested is that you don't just put them together right away. That what you do is you put them in different parts of the house and they'll start to smell each other and hear each other, have them have their own boxes, their own food, their own territory, because that's really important to cats is territory. And then you can introduce them gradually. Some people say they kind of put them on either side of a door or a screen door or a door that they can kind of sniff underneath it to kind of get a sense of who they are. And then gradually introduce them to each other. Now, using something like CBD or my relaxed mushroom chews or some other calming aid may actually help to reduce their anxiety around that meeting and could be used as a could be a good tool to use in that introduction. Another thing to do is to look at the pheromones. Look at the feline pheromones. Feel Away is the first brand to come out with them, but I think there are other brands now. And if you can spray the whole house or use the diffusers to get that generic feline pheromone odor in the house as a whole, it also will help to reduce some of their anxiety and territoriality. If they're younger cats, they're more likely to be able to blend versus an older cat that may have had some bad experiences in the past. But good luck. I hope it works.
And so that is currently all the questions that we have sent in, but if you happen to email one to me, and I didn't read it off, please feel free to resend it in the chat.
Mhm.
But that is all the ones that we have been sent thus far.
What about the comments over here? There's a ton of them.
Um,
Do we want to do them? I mean, why don't we go through them as well
sure.
uh, and see what we got? There's a lot of them. Um, so let's see. Let's see. A lot of them are people introducing themselves. Um, but let's see. I know there's some questions here. Started feline RX renal for my 20-year-old hyperthyroid kitty, along with the silver bullet. Good for you. Um, yes, regardless of when you bought the book, if you just have that receipt, Patty, I'm happy to give you that discount. Um, oh, and you already answered that, didn't you, Haley? Okay. When could, oh, and that, Mary, we answered your question. Yeah, I really think you should, check to see for viral infections. Got a PMF bed. Yeah, PMFs are great. I use the Assisi loop on myself. My wife has just undergone chemotherapy and she gets this neuropathy, and so we got a special PMF type bed for that, and it's really helping a lot. And there is a link to the Chi Dog products, Lauren, on our website, and I could talk with you about that some, when you want to. Um, Lauren and I have been doing a lot of emailing back and forth about her dog Oscar. Then let's see. Chi Dog. Let's see. Does Terry have a website? Yeah, she does Animal Wise. Thank you. Even cats love the salmon and quail feed. I'm going to have to try those for the cats. Which fermented foods are your top recommendations? Not brands, but foods. Um, well, I think really fermented goat's milk, I think, was the first thing that really hit the market as far as fermented foods. Answer's Pet Food started with that, but then Billy Hoekman and Shannon, Billy Hoekman with Green Juju and Shannon with Solutions have continued that. I'm not recommending either, but they're both good companies. I see that Green Juju now has a fermented mushroom probiotic, which I tried to order, but they're out of stock. But they have three different types of probiotics, and a lot of them are using like soil-based organisms. So I'm really interested in seeing what those can do to help regulate the microbiome. I think fermented beets is another one that they have. And some have fermented like turmeric and whatnot. So I think fermented anything is good. Kefir even can be pretty good to use as well. Um, let's see. Lion's mane, time of day, silver bullet. How long do you find it takes to full effect? Massage for dogs. Hi, Mary. Um, body sore was a great herbal formula for a previous cat's arthritis pain. Jen, I'm curious how well your cat was able to tolerate that. Were you using the tea pills or the powder? Some of those Chinese herbs could be a bit challenging for a cat, but Body Sore is a really good formula. Dr. Shea, we carry some of Dr. Shea's cancer formulas, and we can drop ship many of his products. I've considered carrying more of them. He has some really good Chinese herbal products there. Um, and what's the difference between their Silver Bullet and Hemp RX other than strength? Well, I would say the difference is, and Hemp RX now is organic, I see. One, the price, our price is much, much better. Two, we have the CBG in our in our Silver Bullet and Sterling Silver, and that was not in the Hemp RX. I created the Hemp RX um, in 2015, 10 years ago, for RX vitamins. And so I'm responsible for creating that one. And when RX Vitamins let me go, or all that stuff happened, I wanted to create a brand that would compete with them and would compete really well. That would be less expensive and more powerful. And so that's what I created. And I'm always surprised when people still use Hemp RX, but I know that commonly people are using Hemp RX because their trusted and beloved veterinarian has recommended to them, because I did such a good job working with RX vitamins for 25 years that I got a lot of veterinarians to be convinced that I knew what I was talking about and I created a good product. So, and once you get a product that works, it's hard to change. I understand that too. So that's why we still offer the Hemp RX, even though they've raised the prices and everything else, people still are buying it, especially when we have like this 30% discount that we're doing this weekend in response to National CBD Day. And you should all have gotten those mailings as well. Um, let's see, Patty says uh, silver bullet on a piece of freeze-dried food, simple food project. I'm not sure what she's saying there. There may, and then Jen asked that question. Yeah, that was a good question, Jen. Um, and then what fermented foods are top recommendations? We're asking that again. Foods, not brands. Yeah, I think you can really go for anything. I like the fact that Green Juju actually offers four different fermented products. Three that are one's leaf, one's soil, one's something else, and then they got the mushrooms as well. I spent some time with Billy last month and really got excited about what he's doing. Let's see. Let's see. You use the body sort capsules, split them in smaller capsules. And so you put them into smaller capsules and administered them that way, huh? Okay. I think they have some of them in tinctures too. Do you have any date yet? Yeah, what's our date for the session later this month, Haley?
That'll be August 28th. And the if you go to wellpetdispensary.com/DocRobLive, you can sign up for that session on the 28th. That topic will be epilepsy.
Okay. Um, yeah, LaRonda, itching is so difficult. It really is. And I'm sure we've discussed it, PEA and things like that. Maybe we need to adjust dosages. Gel caps were the only way we could get gel. Oh, I see. Okay, great. So I guess that's what's this last one from Mary? I answered what he asked about my cat, that she does have an upper respiratory infection. It has a 7 years. I've had her. They say because she didn't get a shot as a kitten, but I'm parent number five. Antibiotics they prescribed before, they won't anymore. Okay. So have you tried? So this is Mary with the cat that has the crusty nose that I think is probably a viral infection. Have you tried lysine or something like that? Mary, why don't you reach out to me by email and let me see what I can set you up with that maybe would work. Because maybe if we were to just use something gentle, that like a lysine type formula and maybe a mushroom to improve immune system function, because your cat's been living. I mean, what I get is that your cat's been living with this for those many years, and that a number of people have given that cat up for adoption, and you're now the fifth owner. So reach out to me. Let me see if I can help you. I don't know if I can. It's worth a try. Okay. So, well, this is good. So let's go ahead. We've got all the questions answered, and if you have another one, throw it at me. So let me talk about, and I started talking about the products already. Let me share, and actually, how are we going to do this, Haley? We didn't really discuss this. I was going to have you show pictures of the products. So and then you'll have to share those, right?
Yeah,
And
yeah, yeah, yeah. I mean, if you wanted to
Hear the same thing at two different things at the same time? Is that
Yeah, let's see. Okay, so you can see that there, and then let's see how I can pull it up and share it.
see how that works? But other than that, I can just, as you can see, I've got two things here that describe what they are, and we can go back and forth as well. We talked about, and actually, we already did some work here. I already talked about the organic silver bullet tincture. It has 1,800 milligrams of CBD in it. Now, the Hemp RX Forte has 1,800 milligrams of CBD in it, but that's in 2 mLs. So that makes it 30 mgs per ml. This has 60 mgs per ml, so each drop is much more concentrated. I made it that way on purpose, particularly for dosing small animals where we can just, that may be a little bit iffy about taking a larger volume of tincture, like maybe a cat that we could maybe mix it in with some really tasty canned food or something. So it has the 1,800 milligrams of CBD, and the half the amount of that is CBG, or 2,700 milligrams total, and it uses a MCT carrier oil. The sterling silver is much less potent, as you can see, 500 milligrams as compared to 1,800, and 250 as compared to 900, and it has 16 milligrams per CBD. But it's designed to be for smaller animals and as a less expensive starter formula for you to try. The Silver Dog Fortes are starting to get popular, starting to gain some traction. I think these are great chews. Unfortunately, before I get you too excited about them, I'm having problems with the manufacturer right now. I apologize. We're almost out, and he's not going to be able to get started last month, like I tried to get him to start. So we're going to be out of them for a little while. And when we get back, when they're back in stock, we're going to do a big deal about them and offer them pretty inexpensively so you can try them out. But in addition to having 12 milligrams of the CBD, I mean, there's some tinctures of CBD that don't even have 12 milligrams per milliliter in them. 6 milligrams of CBG, but it also has the lion's mane and has the cordyceps, 500 milligrams of each per chew. So it's good for a lot of things. It'd be good for calming. It would be, because of the lion's mane in there, it'd be good for activity because the CBD will help to reduce any kind of discomfort with movement. And the cordyceps is a mushroom we haven't talked about much, but I will at some point in time, which is really great for activity and stamina. It helps to promote the development of ATP, which is the molecules of energy in the body. And the Silver Cat soft chews, we are almost out of these. They didn't go very well. Soft chews for cats are not super popular because people don't want to spend the money and find out their cat's not going to take it. So I'm kind of going through a redevelopment of these. I'm trying to figure out how I can make them more popular for cats. So stay tuned. We'll get that one figured. And then the mushroom products, I thought these actually all pertain to a lot of different things. The immune mushroom chews are, as it sounds, are primarily for the immune system in terms of the mushrooms that are in there. But we get a lot of anecdotal reports from pet parents that are on the immune chews, that tell me that they also see behavioral changes, that the animal's a lot calmer. That might be because we have ashwagandha in there, and ashwagandha is an Ayurvedic adaptogenic herb that can also promote calmness at the same time as it can help with activity and stamina. It has antioxidants in it like blueberry powder and olive leaf in it. Maybe not the first thing I would look for behavior, but we have heard that some animals do seem to have improved behavior when they're on that. The relaxed mushroom chews are more of the behavior ones, and they have the lion's mane and the reishi, the tryptophan and theanine, and calming herbs. It has catnip in it, and my cats like it. It has valerian in it. It has lemon balm in it. It has passion flower. And so those all give an immediate calming effect because the mushrooms, as I explained, don't don't generally give us an immediate effect. So I wanted to have something that would help to work to keep the animal in a settled state while the mushrooms were building up in the body. Um, the mobility chews are our newest chew. And they've got green-lipped mussel in them, which is a good source of chondroitin. They've got boswellia, which is the Ayurvedic herb that is good for pain. I take it myself quite a bit as an old guy. MSM, which is good for inflammation and commonly has been paired with glucosamine or chondroitin-like products. So using MSM with green-lipped mussel is a good duo in terms of them having a kind of a 1-2 punch for pain and mobility. And then it has the cordyceps for energy and stamina, and then golden oyster, which is an ergothioneine source. And we're finding now that ergothioneine, in addition to its antioxidant properties, also works at the mitochondrion, which is the powerhouse in the cell. So it really helps to improve energy and stamina, which could also help to power mobility. And then the two last ones are my meal toppers, Daily Dog and Functional Feline. And what I did was I added two more mushrooms to the five defenders. So we have lion's mane and cordyceps in addition to the reishi, turkey tail, maitake, shiitake, and chaga in there. It has active probiotics, the Saccharomyces boulardii, and it has detox in it. It's got milk thistle and cracked cell chlorella. It uses a base of krill meal, which has astaxanthin, which is a very powerful marine antioxidant. It has marine lipids, EPA, DHA, and phospholipids as well. So it's a really very, very powerful palatant that I've added to the Daily Dog. Plus, there's seaweed in the Daily Dog for the dogs. We took the seaweed out of the formula for the cats because seaweed contains iodine, and some cats can be sensitive to iodine because of the hyperthyroid thing. So it's basically the same as the Daily Dog, but I put even more cordyceps in it for cats because we're finding that the cordyceps can help to protect the kidneys in cats. And that's really one of the most sensitive organs that we see, especially later in life in cats. And so I think that starting your cat early on cordyceps and keeping it on cordyceps for its whole life is a good strategy, especially regarding those kidneys. And lungs as well. Cordyceps is also good for the lungs and for asthma, for feline asthma. So we took I should have put without. So we also took the seaweed out of the functional feline. So it's basically the same. So those are products I think are worth knowing about. Um, and you've got some discounts coming. We have a discount for tonight too, don't we,
Yep,
Haley?
yep, yep, yep. So I
Yep.
did post it in the chat. It is Doc Rob Live 87 will be the code. That'll be 25% off site wide.
Okay.
And will it can't be combined with any other discounts or coupons. So I would say if you are looking to, purchase that sterling silver, the silver bullet, do it tomorrow. Let's see, tomorrow, the 9th or the 10th is our sale, and that's 30% off. So you get a better deal than the 25% off. So you could use the 25% off later. That won't expire until September 7th.
Nice.
So
Well,
it'll be
good.
good for a month.
And I'm always available to you to if you have questions about applications or dosing of anything we've talked here. And Diva, I guess you read my Boulder Bookstore talk. Thank you for coming. I recently gave a mushroom a book reading at our iconic local Boulder bookstore, and I'm starting to do more things locally. I'm going to start giving talks at local pet stores. I'm looking to go to Longmont and give a talk at Four Paws up there, and I'll do something down at PC's Pantry in Boulder, and I'll go up to Fort Collins and do places in Denver. I may do Tattered Cover. It's a lot of fun. I'm glad I wrote the book. It really it's kind of a great way for me to introduce this whole concept of natural health for pets. I appreciate everyone coming tonight, staying on for the 90 minutes that you're here. That's good. And I hope that you like my style. I'm kind of building my style as I'm going, getting more comfortable with talking, not as self-conscious. So, great. We'll see you on the 28th of this month. We'll talk about epilepsy.